here, Sex on the Spine at the end of the day, and I'm glad that a lot of the questions we are steering our answers towards, you know, more medical-based type answers here. My next question is really more about that. Why is it important to use lubes, especially after you've had some kind of medical treatment or after an injury, especially a spinal injury? Why is it a good idea to use a lube?
I'd say after spinal cord injury, when I'm talking to my clients, often it's about getting that glide. If it's, you know, if there's certain parts of the body that they don't feel or that are hypersensitive, it's really important. I'll ask people to try different types of lubes on that area, or different types of oils, depending on what it is they want. And really looking at, actually, with a harder touch, how does that feel? Mm-hmm. With a lighter touch, how does it feel? With nothing on the skin at all, how does it feel? And really play around with that, the sensations of it, just to find out, because a lot of people are like, that's really hypersensitive and it really hurts. But when they experiment with different types of lubes on their skin, often it's like, well, that doesn't hurt as much as I thought it did, or that feels more sensual than I ever imagined it could. So I think, you know, learning, and also putting the lubricants on their nipples and on their skin, so they might have a better slide up each other's bodies, and also obviously for masturbation. But really thinking about the ease that it gives people. And I think Sue alluded to it earlier, thinking about people's ability to be able to bring it into the bedroom, because a lot of people will just go, oh my goodness, no, I don't even want to entertain it. If my sex isn't good enough without it, what is it worth it? So really thinking about people's attitude towards it when we're introducing it. And I think when somebody's just had a spinal cord injury, it becomes quite easy for me to introduce something new, because they've actually entered my office asking questions about what can we do now that's different. So I think lubricants are massively important, and I recommend them to everybody.
Thank you, Michelle. Ellie, your opinion on this would be really helpful. Why is it good to have a lube, use a lube after medical treatment or injury?
Yeah, well, I don't know that I know the answer to this. It's kind of one of my questions to everybody else, which was, you know, post-procedure, post-pain, I think we all find that pain is inhibitory for lots of body functions. And certainly I've heard patients complain that their desire for sexual intercourse is less. And I think that sometimes that's also associated with perhaps their body not being quite ready for sexual intercourse as it's still in a recovery phase. So I'm kind of interested to know what sort of some of the more experts in sexual sort of health think about that. And also post-injury, so sort of post-spinal cord injuries, post-Cauda Equina. Is there a link with the actual injury, recovery, and being drier? In which case, I want to understand more about lubricants versus vaginal moisturizers and how we use the two together. Or is it just a case of there's a lot of other psychological processes going on after a spinal injury with worries about partner interaction that causes more of an issue with vaginal dryness? Quite a lot in that question. I do apologise. Just to help me understand a bit more of an overview of why it is that we're discussing this subject in relation to our spinal patients, and as professionals, what we can tell patients to expect and what's the norm, but then B, so that people who are listening to this can understand, well, why me? Why suddenly is everything not working in the same way as it used to?
So Ellie, there's lots of, like you say, lots of different things within the question, and obviously psychologically that's huge, and going through the menopause and after having children and all the different areas of it. But spinally injured wise, if the injury is fairly incomplete, or an incomplete injury where it hasn't been a complete sever of the spinal cord, and there are some sensations, sometimes you'll still find that there is some lubricant. So if you can feel pinprick sensations between around T10 and L2 on the spinal cord, often you might still be able to lubricate. But again, this is so unique with each spinal patient. So I'll ask people to do their own tests when I get them to do some of their own, what class as genital focus or focus on that area, their own self-focus. But actually, if it's a complete level injury, So if it's a complete level injury that's higher than around that T10 area, sometimes lubrication becomes less. And obviously, if you can feel something below that T10 area, sometimes there's psychological response that's still getting through. So sometimes there's that. And then with Cauda Equina, sometimes people will often talk about either having no lubrication sometimes, but again, sometimes that's muddled up with the psychological side of things, because there might be cell numbness, there might be pain in that area. Or some people, once they really relax with the Cauda Equina and get used to their bodies, will often describe that they get wetter than they used to. So there is a specific area on the body where we say, actually, there's going to be no lubrication there, there's going to be some psychological lubrication there, or there's going to be more lubrication than there might have been. So depending on the level of injury and depending on the uniqueness and depending on the psychological response. Wow. So as the question is, the question's complicated, as is the answer, and it's very, very unique to that person. So it's about them really experimenting with themselves.
Okay.
I don't know if anybody else has anything to say.
Yeah. Sorry, Ali. What we're saying is that we need to have that conversation. So anybody, we need to acknowledge that anybody who has undergone a spinal injury or a spinal pathology, this needs to be discussed in an open way. And I think probably what I can relate to is that this isn't discussed with lots of patients and clients that we have.
Yeah,
Okay.
yeah, I would agree. But I think that the fundamental point is that, to answer your question originally, Rob, is that without natural lubricant, sex can be painful and can damage the vaginal or the anal lining. So the sort of basic answer to your question is that we need lubricant for comfortable sex and kind of safe sex for the vaginal lining.
Something that maybe we should have said right at the very beginning of this conversation, just in case we were kind of understanding the point of lubes in the first place, is not to actually damage yourselves down there.
Ladies, what advice have you got for, so in my profession, we use massage quite a lot, and a lot of my post-operative or post-recovery spinal patients will use massage for muscle tone, for scar management, and as we all know, sometimes massage can lead to more intimacy. So if you're going to use a massage medium, which actually we tend to use oil-based, but clearly from what you've said, that might not be the best choice, what would be a better recommendation?
I would go with the oil-based that you're using for massage. I wouldn't have a problem with that at all.
And if you're then using that for lubrication, would you go with that, providing there wasn't any issues with if you're using a condom or?
Yeah, the main thing is if they're going to use a condom, then not to use the oil for anal or vaginal use, because it will degrade the condom.
Right. Areena, you've got something that I think you wanted to talk about when it comes to Cauda Equina.
Yeah, I just wanted to, I think it's a bit both to Michelle and Angela, I would say, because of the patients that they see. In terms of Cauda Equina, I think one of the main symptoms that people have is the numbness, is the numbness around the vagina and, the lack of sensation there. Do you feel a lot of patients have this, sudden fear or this resistance to using lubes because they're like, well, we can't feel anything anyway? And there are as Sue mentioned, there are these different types, minty and, different feelings, but they don't appreciate it. Do you kind of feel this resistance that patients have when they, when you suggest it to them, or does this not make any difference at all that they have numbness or decreased sensation?
I'd say they were often more open to trying that. I don't know about you, Angela.
Yeah, certainly. And I do think because the issues are complex, you don't know what's to do with the relationship, what's to do with anxiety, what's to do with the damage from the injury itself, that actually I would tend to recommend it to any woman really, because you don't know what's causing what necessarily straight away. So therefore, to get in the habit of using lube and getting comfortable with lube, because that, if some of the lack of because some of the lack of sensation can be to do with anxiety and the fact that they're spectatoring, they're in their head trying to monitor what they feel, that can reduce sensation. So you're almost like trying to encourage them to use anything that might make it better, because you don't necessarily always know with everybody exactly, you know, what the lack of sensation is related to.
Yeah.
So anything you use that can help in any sort of way is going to be useful.
Thank you. That actually leads me really perfectly actually into asking the last question that I sort of had today, which was, you know, how people decide what the best lube is, what the best treatment is, you know, or, you know, resources for people to use. You know, how do you decide for each patient, client, you know, what the best treatment is, or what the best thing is for people to use?
I guess in my private practice, in people that I've worked with, I guess what the because some of the people that I've worked with, if they've had not an injury as such, I've worked with people who've had prostate cancer and they've lost certain ability, or they've had any cancer, and some people that want to try for a baby, and so it's looking at certain lubes that then doesn't reduce any attempt or effect on the sperm, and there are lubes out there that can help to do that. But I guess as I'm hearing you all talk as well, it's making me think about, and I don't know, it's just coming like, I know there's these lubes out there, silicone based, water based, oil based, but I'm also so aware of food. And the biggest organ that goes on in us, you know, we've got our brain, but we've got our skin. So that's a really big part of the intimacy, the sensual touch, reconnecting. Because when somebody's been through a traumatic surgery, they may have lost of certain function, sensation, numbness. It's really about, you know, acknowledging that loss, but also accepting that their sexual style is going to be different, and they're learning a new style. So I feel like sometimes food has a really good place in that, the taste, the texture, not to, well, whether, to use it down below, some can. Bananas.
Okay.
I'm just wanting to bring that, you know, the variety of it and the fun of it, because if someone's gone through such a traumatic experience, and, you know, the loss of function and surgery, to be able to reconnect and bring those different tastes and flavors and a new sexual style into play.
Oh, I think that's a great point, Lorraine, because it's like Ellie and Michelle said, you know, you need to improvise, you need to start enjoying again. I guess that's the gist of it all. You've come through a spinal cord injury, or you've come through a trauma, you've come through something like Cauda Equina, or if you've had a cancer, or if you've been diagnosed with some any condition for that matter, any medical condition, you're going through that trauma in the first place. And then to be able to get your mind and set the mood right and set, you know, think of something pleasurable seems to a lot of people as inhibitory. And so this is a way to sort of improvise, make yourselves feel better, make your partner feel better. And as you said, the skin is something you have to work with. Totally.
Yeah. Absolutely. And it's to maybe make it not so clinical. And just my own personal experience, I've gone through my menopause through stress and everything. I've also gone through cancer and I had chemotherapy. I had to adapt and change my sexual style and my relationship with my body. So yeah, it is. It's about bringing the fun and the excitement, and like an adventure, really. It's
absolutely
new. I'd also like to say, in regards to, I know we're looking at lube and we're looking at using it within sexual pleasure and intimacy, but I've also used lubrication just on a daily basis because I've become so painful just during the day, sharp pains that come through. And I never thought of that before. It's only through my supervisor. I've just connected lube with when you're being intimate. And I said, oh, I'm really painful, you know, really dry. She said, well, you use it during the day, throughout the day as well, you know, because it takes away the pain then. So I didn't want to take it away from what we're looking at and the intimacy, but also lube is used just to ease the pain during the day. It's not just for
and that's why I would always encourage women to use a vaginal moisturizer, even if they're not sexually active, because it's really helpful to maintain the vaginal integrity and help the tissue and everything feel far more comfortable, not only from a sexual point of view, but from a, you know, a urogenital point of view. It's really, really important. And I would say that to Ellie, you know, if you're having that discussion with anybody in the clinic that you think their vaginal lubrication might be affected, even if they're not ready to be sexual, to get them to think about using a vaginal moisturizer, because it's so important.
Yeah, I think, Angela, that's the biggest thing that I've probably learned from today, from my personal practice, is that actually we talk about lubrication and we always think about that in the context of sexual activity. But I agree, a lot of preparation with certainly my patient goes into their rehabilitation before they're actually ready to take that step into intimate and an intercourse. And really, that's really helpful, actually, because I will tell people that as part of that preparation, a vaginal moisturizer, which encourages intimate touch to yourself initially, and also self-care, is the perfect preparation. I can build self-massage into that. I talked about masturbation in the last talk. But all of that is unraveled before you're then ready to take the next stage to full intercourse. So that's really, really helpful. Thank you.
And sometimes also, if before somebody is ready to be sexual, and you're teaching them about massage, even starting to do gentle things like hand and foot massage or neck massage that can be quite sensual but not necessarily sexual yet, but you're getting used to touch in a way that can be sensual but doesn't necessarily have to lead to something sexual straight away. So you're sort of rebuilding that foundation of intimacy.
Yeah, and I'm thinking as well about patients who have spinal cord compression. This is secondary to their cancer. Obviously, there's such a lot going on, and their cancer is advancing at this point. And so it's very easy to lose the sexual context in that scenario. But to maintain things like vaginal use vaginal moisturizers for anybody that would want to make love in their future, and to maintain intimate touch.